Getting started on our reality of mental health and kidney disease, our agenda for this portion is we will have a wonderful presentation from Gabriel Cooper, and then we'll have some time for questions and answers at the end. So getting us started, Gabriel Cooper is a kidney pancreas recipient since 2021 and a psychotherapist in California who has a practice of his own that specializes in chronic illnesses, relationships, and anxiety. After decades of navigating both type 1 diabetes and kidney disease, he is dedicated to passing on the gift of transplant by professionally supporting other kidney patients in their journeys. He continues to actively participate in endurance running and advocating for the LGBTQ+ community. Gabriel, thank you so much for joining us today.
Hi, Emma. Hi, everybody. It's a pleasure to be with you today. So, thank you for the great introduction there. I'm sure you'll get to know a little bit more about me too during the presentation here. You can go ahead and go to the next slide. Okay, so as Emma said, I'm a psychotherapist. And so I work with patients with chronic illnesses, some who have chronic kidney disease and who are in ESKD, some transplant patients as well. I also personally have gone through the process. So I went through about 10 years of kidney disease with the stages, 2 years of dialysis. For me, it was peritoneal dialysis. And about 2 years ago, I got a transplant. So now I'm a transplant patient. So in the next about 30 minutes or so through the presentation, I'm going to structure it from both of those perspectives. So I have the unique perspective of working with people around mental health, and then specifically transplant patients and patients in general who are going through chronic illnesses. And I will examine the effect on mental health in general, but specifically more of the life outlook that it affects, the self-esteem, the effect that it has on mood, the effect that it has on relationships from both a clinical perspective and then bringing my personal perspective, what it is that I actually went through sitting in the other chair. After that, we will go through some typical interventions that we have. I'll leave it to the National Patient and Family Engagement Team to bring some resources in, as well as add a couple of my own. Then we'll leave sufficient time for question and answer from everybody. And throughout the presentation, I really encourage clinicians and especially patients here, especially caregivers, especially the family members, to share and respond in the chat with what your experience of these things are, what you notice with yourself, what you see with these things too. This conversation is so incredibly important to have and hopefully illuminating for the clinicians who are going through this to really see beyond the numbers and see beyond the data and the research and the science, what it's like and how that matches with the experience of what it's like to go through as a patient or a caregiver or someone who is really close to people who are going through the experience of ESKD, of transplant, of being a kidney patient and living with this. The Q&A at the end, if you have any questions that come up along the way or any points that you certainly want me to speak to, feel free to type them in the chat too, and we will make sure to address those at the end, as well as leave time if any come up at the end themselves. But during the conversation, I highly encourage you to use it as a space to share your own experience. And I'll make sure to leave time at the end of each of these little sections so that we can really address that and get a sense. We can go to the next slide. So the reality of kidney disease. Kidney disease is often viewed and approached through the lens of science and measurable, concrete physical outcomes. This is how we've made strides in care in extending people's life and the quality of their life, and for good reasons. It's very scientifically based, and a lot of times clinicians are by clinicians, I mean people who work providing care for those patients with kidney disease. So this can be your doctor, your social worker, people who come from the perspective of providing care. And from that perspective, it's informed by science and measurable concrete outcomes. Why this presentation is titled The Reality of Kidney Disease is really to emphasize what the realistic experience is and the personal experiences of what it's like for kidney patients, how those numbers might translate, how they might look the same, but also how they might look different in subtle ways that might not be obvious. And it's really important for the clinicians to know this. And I'm hopeful that we can get a lot of you sharing your experiences here and see just the nuances behind the numbers and the concrete facts to really enrich our understanding. And it's also important for patients to hear this as well. When the team at the National Patient and Family Engagement plans was when we were brainstorming what we should do with mental health and kidney disease, we did a poll and got a lot of feedback, and it really seemed like what the patients were asking for beyond resources was to normalize, to actually hear that other people are going through this, to know that the things that they're experiencing are actually somewhat par for the course, to hear that they're not in this alone. All of these things that were not told to them that they might be experiencing and is involved in the reality of this, things to watch out for, things that just surprise them that are outside of the medical, statistical, physical outcome realm. So it's really important for I think everybody involved in this conversation to hear these true experiences. All right, we can go to the next slide. We'll start here with life outlook and how that looks, how that's expected to look, maybe, and how it's changed, at least in my experience as a kidney patient. You'll notice in these slides, if you're using the slides for reference here, the left side here is the clinical piece of how it might be approached from clinicians. And then the right side is the patient perspective, namely being my perspective. So I'm not going to spend too much time on the clinical side. I think it's information that a lot of us are familiar with. I'm going to spend more time on the actual personal side of it and really painting that reality with some brush strokes. So how we can expect kidney disease to affect our life outlook from a clinical perspective is it's an end-stage disease. It's in the name, right? It is the very final stage of a progressive disease. There is no reversing it. It means the end of these organs. There are solutions to help extend your life. There are solutions to remedy this, and that solution is transplant. In the kidney world, it's often viewed as transplant is really the only solution or the absolute best solution. And I want to highlight that as well, because as it's presented, that sometimes transplant is the only solution to it, there are many other solutions to living with kidney disease and living in this end stage that are just as valid and do provide wonderful opportunity to live a very full, rewarding, and healthy life. Clinically, there's a lot of hope if we have a perfect care routine or close to perfect. If we do X, Y, and Z, we watch our sodium intake, we do dialysis, we don't miss a session, we take our binders at the right time. There's physical adjustments. This slide says psychical adjustments, maybe some of psychical adjustments as well, but there's certainly physical adjustments for life that need to be made when you're going into a dialysis center or when you are on PD or home hemo. There are also these resources for these dietary changes, these medical changes and needs, and learning more about your disease. All these resources are also given when you think about what your life will be like when it's presented to you in a clinical capacity. Going to the personal side of it. So my experience when I heard end-stage disease, ESRD, end-stage renal disease or end-stage kidney disease, ooh, that's not an easy pill to swallow. It changed my entire perspective. And for me, it was on a more subtle, more subconscious way, in that you can go from thinking that your abilities, that your life, that your goals were headed one direction, or maybe you were able to shoot for the moon in some places, and all of a sudden you have this disease that is in its last stage. You will no longer have full function of your kidneys. You will no longer be able to necessarily do all of the same things that you had before. End stage also has a connotation of, man, this will be the end of me. Your life is statistically shortened significantly for many conditions. And it's a weight that I say subconsciously because something that I personally didn't realize until I had the transplant and no longer have this end stage disease. It's a weight that you carry constantly. That's always kind of grading. You're always working toward the end here. There's nowhere to go but toward the end of this. So, in my perspective, after transplant, which is something also to consider, how that shifts extremely, I noticed just how heavy of a weight it was carrying it the whole time. For solutions, I see comments coming in, and I'm great, encourage more and more. And at the end here, we'll stop for this section and make sure to get to some of them. So for solutions, we're given solutions. Great. There are ways to do it. However, that can give a huge sense of falling short of solutions. Your health is continually declining. There are deficits that continue to grow. And while solutions are hopeful in some way, and for me, I felt this extreme need to hold hope to meet some of these solutions, you have no choice but to really be hopeful here. It's you have to hold hope to fight for your life. At the same time, it's very difficult to hold hope, and in some sense almost hopeless, because these solutions aren't easy. We often come short or realistically fail at them sometimes. The solutions don't give us back what we had before. They still don't give us, even transplant don't give us full solutions. There's a lot of ambivalence here that I notice I have to hold when presented with these solutions that are often clinically prescribed and encouraged heavily. There's a lot of emotions and nuance that goes behind that. With that also comes the hope you have to hold. And for a perfect routine, while it would be great, it takes sometimes an overwhelming amount of effort. A perfect care routine or somewhat close to perfect care routine for dialysis, for kidney disease is incredibly difficult and time consuming and energy consuming to maintain. And there's lots of numbers that were given at every one of our check-ins that it's very easy to fall short of one of them, sometimes for many times not even our own fault, things that are not within our control. And falling short of them makes it difficult to hold this hope. So the importance of normalizing, it's okay to fall short, and you can still have hope, even if you don't have the care routine in all of these places. In many of these places, that's okay. It takes a lot of effort and sometimes overwhelming to hold, to be able to hope for these things. Beyond physical adjustments that are certainly part of life, it affects our relationships, so relational adjustments and psychological adjustments as well. For me, the physical adjustments meant that I was no longer able to participate to the same extent, largely to any extent, of something that kept me physically healthy, and was a big part of my relationships, which was endurance running. And that was something that increasingly became harder and more difficult. I was also a type 1 diabetic, which some of you out there may be as well, or the patients that you treat may also have both. So there are additional complications with some of the comorbid disorders with kidney disease. And there's lots of physical adjustments to what you are able to do. Relationship adjustments. I could do a whole, we were debating doing a whole presentation on this. Something that clinically, very rarely are you told, as I prescribe, that your relationships are going to change a lot, but that is an inevitable part of living with kidney disease and the adjustment to it. If you're caretakers, so if you have to have a caretaker in your life, it's new, perhaps a new relationship, perhaps that's your partner, perhaps that's a parent, somebody who that relationship will absolutely change in many ways when it becomes a caregiving and caretaking relationship from a neutral one. Your relationships with your friends will change. Your relationships with family will absolutely change as well. And these really affect our sense of belonging and our sense of who we are and how we are in the world. Lastly, there seems to be a lack of people around you who truly understand what it is that you're going through. At least in my experience, as the only one in my family or the only one in my immediate circle who had CKD, who had ESKD, is that it feels very lonely. It's not visible. So while some of the symptoms are visible, you have to, and the treatment is visible, people don't necessarily understand what's really going on and the toll that it takes. They may be able to sympathize, but really difficult to empathize. And connection here is vital with other patients, with other people who know what this is like. On forums such as this, it's, in my experience, was really a saving grace, was the most important part of my mental health and well-being and holding this hope. But as you go through your life, you might not have many people in your life. I think it's probably more rare than it is common to develop deep friendships or familiarity with people who are also going through this ESRD experience, and it can leave you feeling very, very, very alone and isolated, even in your own family or group of friends or work environment or relationship or places where maybe you felt like you belonged or people understood you before. Go to the next slide. With a lot of my patients, it's helpful to use this cycle of grief to put words to something that they may be going through that also a clinical team or a clinical person might understand. It's a common language, really. I wish this graphic wasn't in a circle. Uh, Grief is actually not necessarily a cycle. All these things can happen. The denial, the anger, the depression, the bargaining, oh, I could have done something, or maybe I can do this. And the acceptance can come at any time in no particular order in any amount of intensity. And this grief process, the grief of losing your organs, of losing a lifestyle that, and perhaps the way that relationships were, um, is really a process of grief, a continual one that we are stuck in and going through. And any of these things, this denial that it's happening, that we have to monitor ourselves 24/7, no holidays from it, no lunch breaks from it. Um, it's really human and natural and happens that sometimes we just want to be in denial about it. It happens that we get really angry about it. Depression, absolutely. It's really hard to be positive about it a lot of the time. Bargaining, yeah. Is it our fault? Could we do something different? And acceptance, that comes and goes in waves. Still comes and goes in waves for me, no, even after transplant. So this process of grief is something that is really a, true of an experience of someone through ESRD. All right, we'll go to the next slide. Should I want to stop before we go to self-esteem? Maybe even go back a slide. I want to make sure that we are getting addressing anything that was in the chat here. I just want to go through and see lots of comments. It's great. These are great. Instead of addressing these now, because we are kind of short on time for this, I'm going to save these to the end. But please keep on offering your own experience as we go through this. Right. So we can go to the next slide. I'll make this a little shorter too, just so we can have time to really address everyone's experience here. So self-esteem. Self-esteem means the confidence in your own worth and abilities. Abilities is important here when we talk about the reality of the self-esteem. Clinically, at different stages, you are going to have different abilities in your life. We're on the clinical side here. Clinically, there will be adjustments to your diets and your routine. Clinically, there are some very predictable physical side effects that will affect you at different degrees, different times, and there are mental health side effects. There are many studies, depression with ESKD patients, anywhere from 25 at the very lowest numbers that we see to 90%. of people who have who suffer from depression who are on ESRD, anxiety, insomnia. There are many others, and we can measure this clinically. There are mental health side effects that it's important to watch out for. From a personal perspective, self-esteem can come with constant comparing. For me, it was comparing to where not only where I used to be and what I used to be able to do and how much of my life I used to be able to participate in. I was working before as a therapist, seeing many clients a week, full-time engaged and working extracurricular activities, and was no longer able to do many of those things. Working included, my ability diminished over the stages of my kidney disease. And it's difficult not to only compare with what you had, but also compare to maybe where others are, maybe other peers and friend groups, but also where others on dialysis or in ESKD are, or and that includes transplant recipients. There's a lot of comparing to try to figure out where it is that you belong, how it is that you're doing, because again, this experience can feel very lonely and solitary. So it's very natural of us as humans, we want to compare to learn where our place is, how we belong. Um, and this can have a great toll on our self-esteem when we do have these when we do have diminished abilities, and can really affect our sense of worth and belonging. We inevitably have less control over our own life. There are complications that happen all the time. There are uh, many unexpected things that happen, and this leaves us feeling perhaps like we have less agency, like we have less ability to have control in what we want to be our life. Boundaries are certainly complicated here. Again, boundaries with our who may have previously been a family member or a spouse who is now taking care of us, boundaries with friends, with family. We now have time limitations. We now have dietary limitations. We might be that person or the patient or the person who always needs accommodations or whatever it might be. Sometimes these boundaries are incredibly important to have to express our needs and get the care that we need. And the boundaries might change here, and that's a very difficult thing. That's one of the primary things that I help people who suffer from chronic illnesses and who have ESKD with is these boundaries. No one necessarily coaches you or tells you how to move them, but they need to be moved. So a lot of times they'll end up in these very unhealthy cycles that really affect our own worth and really affect where we may have found our self-esteem before. Um, they become sources of guilt and shame, and the boundaries change, and that's not an easy process, let alone if you don't know to expect it. We're not able to trust ourselves as much because we aren't able to trust our body as much. We can't predict as much what's going on. So it can certainly manifest in ability to even trust that you know what you're doing, or that this will be good for you, this will help you, or this won't. with that comes a huge potential loss of identity, being who you had be. For me, loss of my big identity as an athlete, as a full-time therapist who was helping people through these things. Those things were just slowly taken, slowly compromised because they had to be. So you can go through a very large identity loss and having to reimagine some of these things at a stage in your life where perhaps it's not typical of development or what you had been told or expected, but this whole additional identity loss and reimagination that happens around these organs. Go ahead to the next slide. So relationships, we're told clinically, you're going to have a medical support team. Your nephrologist, if you don't have one already, probably becomes primary. You are going to need somebody to help you, maybe a caretaker. You will have to have support. That may include low sodium or kidney diet, other people knowing about this so that they can cook for you or they can help you navigate these things. So it may involve other people, as well as you may have new relationships at the dialysis center where you'll be spending a chunk of your time if you choose to do hemodialysis. What that looks like from a patient perspective is there's a huge, enormous time commitment at the expense of other things. Not only the time that you spend going to all of these appointments, scheduling all of them, going to your treatments, but also the expense of what that does mean, maybe at the expense of working full time, at the expense of seeing friends, at the expense of you name it, just a really large commitment that takes away time from relationships. And if it involves other people, like a caretaker, maybe that complicates the relationships because now they have to take on an extra time commitment as well. For me, this was interesting because as a type 1 diabetic, my endocrinologist and my podiatrist and my ophthalmologist and my I had in my GP, all these people I had a relationship with because it was about managing diabetes and maybe even general health. But the moment that you really become an ESRD, ESKD nephrologist is the emphasis. Your nephrologist becomes primary, so you develop a very maybe close relationship, but all of your medical treatment, at least in my experience, my medical treatment prioritized my kidneys over everything else, even sometimes at the expense of effects on other organs or long-term effects. So it really is a shift in your care from when you just may have CKD or you're not technically in stage to the hyper focus on everything is really managed by a nephrologist, and that is the most important thing. Constantly a patient. So I'm curious what other patients and family members have to say here. This is something that I work largely with it takes up most of the underlying issues with patients here. My own patients, what we work with is the identity as a patient in many of your relationships because the kidney care is so important. and it comes first, and maybe it needs to be known. This identification constantly as a patient, and that happens in your relationships as well. Sometimes with friendships, friends might not know what to do with somebody, and might view you by your disease or a patient of ESRD because the requirements demand a lot. Your most intimate relationships, your family relationships, you might also have that tendency to be viewed as a patient because sometimes your health is the most important thing. Boundaries and priorities become very, very tricky. There's becomes a stigma, where there becomes a stigma where if you put once you're a patient and once it becomes about your kidney, sometimes it becomes that you're doing good or you're doing bad or poorly. So it often becomes, oh, you're doing a good job at this, or your numbers are good or they're bad. And there's becomes this stigma of being good or bad at your health. That is really, really difficult to avoid just by the nature of it being framed, but sometimes the relationships can become even more complicated and our feelings in those relationships because we might have the tendency to think that we're good at our health and we're being good kidney patients or bad kidney patients, and there's lots of shame and guilt that can come along with that. Where the reality is that we're all we're neither good or bad. The reality is that there's many, many, many unpredictable things that happen, and we're all managing really the best that we know how, and most of us try to do the best that we can, and they are simply just numbers. Our communities might also change along with our identities. Perhaps at a dialysis center, you'll have new dynamics there and a new sense of community. Let's go to the next slide. All right, so for the sake of time, I'm going to go ahead and just kind of run through this real quickly so we can get to questions, answers. I'll just summarize this in saying that with mood, as a patient, it varies a lot. It's unpredictable, and that's okay. Oftentimes we feel helpless. There's a sense of uselessness. We're less productive than we used to be. We have less functioning than we used to. We're less capable, and that can affect our mood greatly. So, sometimes in positive ways. Sometimes it's great when you have your blood cleaned and you feel great all of a sudden, and there's some gratitude in there. There's some excitement, but oftentimes it can affect it in negative ways too. And like grief, these emotions and these moods just can be a little unpredictable and come at any time. Go ahead to the next slide. Some of the interventions that we have, there's medical interventions, cognitive interventions. Typically, we address this with CBT, cognitive behavioral therapy. There's behavioral activation and interventions that we do. For instance, like decreasing the amount of alone time, ruminating less, finding more pleasurable activities, relaxation techniques, mindfulness, breathing, breath work, peer support is, as I said, was one of the most fundamental interventions that helped me through this, connecting with others who are going through this, who might understand. Go ahead to the next slide. my contact information in case uh, you had any questions at all. I am available as a peer uh, for patients, family members, clinicians. Feel free to reach out to me. I believe this will be included in the follow-up, so hopefully it's there. You can always find me on Psychology Today or ZocDoc and contact me. Love to hear from any of you. I'm very responsive and love to share my kidney journey and help wherever I can. Next slide. Great. So we have a little bit of time for some Q&A.
Thank you so much, Gabriel. That was amazing. We apologize to have shortened your time. There has been quite a lot of chatter. People are just very grateful for you sharing your experiences, not only from a patient perspective, but we've had a few caregivers, care partners, who have appreciated your insight from that standpoint. There's quite a few people who are asking if you're accepting new patients, if you do virtual. So I'm not sure if you wanted to speak on that or just ask people to reach out to you at your contact information.
Yes to both. And yeah, please, you feel free to reach out to me at that contact information.
Great, thank you. I do see a question that just came through. It says there's been chatter around helping dialysis patients with behavioral health needs. Do you have any insight on that?
I'm trying to, feel like again, that could be a whole presentation. I think that might be a little too, I would say, perhaps for the brevity, just because we only have about 5 minutes left here, maybe you could feel free to email me that question and I'm happy to respond to you about that. We can save it for the end here, but I'd like to just make sure that if we get to any other questions there, that might not take as long, that might be a little bit more specific, might not take as long to answer.
Sure, and we have your email in the chat. We will be sending this recording and slides out after the summit concludes tomorrow, so your contact information will be available.
Great.
So people can reach out to you. And I know we mentioned earlier that we did have some resources. So as people are thinking of questions, I'm going to review some of those quick resources that we compiled together. So on the next slide here, on our ESRD NCC website, we do have some resources that have been created by our MPFE LAN members. Gabriel was one of our former members as well, so he may have been part of creating some of these wonderful resources. They are available to the public, so for patients, care partners, or just to share with your staff on how to engage with folks in these sorts of conversations. So this resource here is about caring for your mind and body in different ways, and doing it in a way that feels comfortable for you. On the next slide, we have a list of some national resources that we just like to remind everyone of. Our ESRD NCC, again, we have our website that has resources that were created by patients for patients. We also have a YouTube channel that has patient stories about thriving with kidney disease. AAKP, the American Association of Kidney Patients, their website has some amazing dialysis education for, again, patients and care partners and professionals. So we encourage you to take a look at their website if you have not. Of course, the National Kidney Foundation has some incredible educational materials as well. And then on the next slide, we do like to remind everyone to please utilize your facility and transplant center social workers, either to seek help directly from them, or they can help you find local resources, because those are all different depending on where we live and what access we have to them. So please utilize your social workers and your clinic staff for specific resources. And again, I know we have about 3 more minutes. We will continue to open it up for any questions. I see a few coming through here. We do have one question about overcoming stigma placed on society and being able to still thrive and have a successful career. I know that might be a heavy answer, heavy question as well, but if you have any quick thoughts around overcoming stigmas that are placed on folks with mental health.
Absolutely. Two parts to that. First one is, if the only way to get over or to break the stigma is to talk about it. So in choosing, one way to do this is to, if you feel comfortable, so acknowledging that there's stigma there is one thing, and you don't have to address it. If you don't want to, you can choose to keep things private if you'd like. Perhaps work that out in therapy or with peers. Go to find peers who might also be going through this. Forums that are anonymous, like Reddit, are great for that kind of thing. If you do want to try to combat stigma or work through it, something that you can do is to really select people and environments where maybe you feel like it's okay to take to be a little brave here and take a step forward and actually express what it is that you're going through. Maybe it is difficult. Maybe you do have ESRD. Maybe this means that you are tired a lot of the times. Maybe it means that, sometimes you come into work and you're just angry. Sometimes, and choosing select people where you feel safe enough and select environments to start to then advocate for yourself. Be realistic, like we are in this presentation. Be super realistic and say, you know what? It's not it's a little uncomfortable for me to say this, or I get a little embarrassed to say this, but this is the reality of it. And just bringing those conversations. Hopefully, you can bring them more often, and really kind of break some of the stigma and how it affects your personal life, how it affects you. Hopefully, you can take some steps toward it, and more often than not, it will be received better than you think it might be, but also really helps reduce the stigma in general. The more people that know the reality of what this is like, the less stigma for all of us. So both of those options are very fair and valid.
Thank you. I appreciate that response. I know it was quick one, but we appreciate you addressing that. We do have a few more questions, and what we'll do is we'll compile them for you, Gabriel, and so you can have them after the presentation. I know we're at our stopping point, but we are so thankful for you being here today, sharing your experiences, and just being a voice for the community. So many people are grateful for what you brought to our conversation today. So thank you so much.
Thank
We
you.
are
Such a delight.
absolutely.